So I am going to start the May monthly meeting, and as we've been doing for the last couple of months, I will, record it and post it on our YouTube channel so that people who were not able to make it could, of course, come and or come to the YouTube channel and watch it when they are available. So I just have a few announcements to get us started. Uh, some really cool news, actually. We've had a huge jump in consortium members, which I am really insanely happy about. I almost feel like the Georgia One Health Consortium has gone viral, but a lot of that has to do with the work and effort from Dr. Mercer and Dr. Comfer, who have reached out to universities and industry partners across the state of Georgia to get them excited and interested in joining the Georgia One Health Consortium. So in our April meeting, we had 166 members, and now we're up to 256. So it was a huge jump, and it was great to see. We're up from 61 people participating or signing up for Circle, which is our engagement platform, to 77. So, the more people on Circle, the more posts we'll see and the more engagement we'll see. And that's just really a source that we can use in between meetings so that if there's any announcements or any cool things that you want to share across the state of Georgia with the consortium members, Circle is the way to do it. How to sign up for Circle should have been in your intro email that you received. However, I totally understand you probably receive a lot of emails. So if you need that link to sign up for Circle again, then just drop me an email at ihla@georgiasouthern.edu, and I am happy to give you that link so that you can sign up and see all of the really cool things happening across the state. Another thing is, we love seeing representation from organizations in addition to individuals. So if you would like your organization's logo to be posted on the consortium website, we are certainly happy to do that. And again, the consortium is really open to any organization, state agency, nonprofit, community-based organizations, academics, universities, colleges, anything, anybody who is interested, any organization that's interested, if you want a logo, you can certainly put it on the website. Now, I do want to shout out to who I'm calling the leadership team of the Georgia One Health Consortium. These folks on your screen have really devoted their time to meet outside of the monthly meetings to help steer the direction of the consortium, and we all kind of divide and conquer. So I just want to shout out to everybody that you see on the presentation here. They have each played a role in advancing the consortium across the state. Now, one thing that we are working on that I was kind of hoping that we would have like a definitive answer by this meeting, but I think we're going to have to maybe send out an email in between before the June meeting about this, is we are still just trying to lock down a site for the annual Georgia One Health Symposium. We did have the first annual one in Statesboro last September, and so we are looking at trying to come together again. These are the dates on the screen: September 17th through the 18th. With a potential volunteer opportunity on the 19th. But we were looking at a more central location in Macon, and so we are just waiting to hear back from two locations so that we can determine if it's affordable, if we can keep everything at low or no cost. And so the leadership team is like working on that, but as soon as we know, we will be sure to let you know, but please just go ahead and save the date in your calendars if you're able to do that. This is what the symposium agenda would look like. We would have, it would basically start the evening of September 17th. We would have a fun networking session, chance to get together and just kind of hang out in an informal environment. And then all day September 18th, it'll be action packed with different interactive sessions, presentations, lightning rounds, a lot of fun, as well as hopefully having like a student poster presentation, kind of like competition, if you will, and potentially a silent auction. So that's what we're thinking. But again, we don't want to, etch it in stone and then say it's going to cost $2,000 per, registration fee. So certainly, just stay tuned for that, and we'll get back to you soon. So I kind of flew through these announcements so that we could have more time for our speaker and more time for questions. But just thank you so much for your continued support of the Georgia One Health Consortium. Please continue to spread the word. The more people that join, the better. And the more diversity and more disciplines we have represented as well. So please just continue to spread the word. And certainly, if you're already a member, join the Circle community. That's a really cool way if you know of internships or other opportunities like volunteer opportunities, or maybe a really cool paper has just come out. That's where you can post it and share, some awesome successes. Keep a ear out for potential symposium dates. And actually, the next meeting is going to be, I can tell you, I'll fix that. It's going to be on June 26th. June 26th. So let me go ahead and update that. And you can put it on your calendar, but basically it is the fourth Friday of every month, except for like November and December, because those are holidays and we usually move it up. But next meeting, June 26th, and feel free to reach out if you have any questions, or if you know of any opportunities for collaboration. So I'm going to stop there and turn it over to Dr. Samples. And Anna, you can be pulling up your presentation as well.
Well, good afternoon, everyone. It's always a pleasure to be back with my consortium family. And let me just do a real quick plug that we still have some open spots for speakers. If anyone has any interest in speaking, or if you know of someone that you'd like for me or Dr. Weezy to reach out to, we would love to reach out to some speakers and fill our calendar up so that we'll have a full calendar for the year. As Jessica mentioned, in November and December, the meeting will be the third Friday instead of the fourth Friday of the month. So if someone's wanting to speak during those months, it'll be a little earlier. Now, to the thing that we've all been waiting for. I've been waiting to hear this. I've heard Anna Santos speak before, and she's very dynamic and she's a lot of fun. I've always enjoyed her. She and I go way, way back. We're both licensed veterinary technicians. We both are within the university system of Georgia for many years, and we have crossed paths with each other quite frequently over the years in a number of different endeavors. But at the moment, I believe, according to her Facebook page, Anna is the supervisor of small animal IMC at the University of Georgia College of Veterinary Medicine. And she has, in the past few years, really worked hard to bridge the gap between veterinary medicine and public safety through hands-on training that's addressed at canine handlers. She has over 25 years of clinical experience as well as background in public health. She works to equip first responders with skills that are needed to provide immediate and life-saving care in the field. And in collaboration with researchers at the University of Georgia College of Public Health Institute for Disaster Management, she is also working to develop national standardized training curriculums that will support EMS treatment for the working dogs, because, of course, we can't have working dogs if we don't have healthy dogs. So this is something that she's extremely passionate about, and I have found to be very interesting. And I just know you guys are going to love her. So I'm just going to stop because I want her to have as much time as possible. So Anna, I'm going to give it over to you and thank you again on behalf of the whole consortium for agreeing to speak with us.
Thanks, Dr. Staples. Can you guys see my slides? Okay.
We see you
One
and your slides.
Okay, well, and I know I'm not the best Zoom person. I will correct, I have left IMC. I'm working over in research. I have some of my research friends on this that I saw logged in here, so I want to give them a shout out for, our UGA research folks. I'm work as the animal healthcare tech with those guys now. I was over at the hospital for many years, for about 25 years. And then moved over to research a few years ago, which actually kind of it segues into how I got into doing this work. I finished my MPH a few years ago, and my MPH was actually in disaster management. And as many of you guys know, if you do have an MPH, it's very human oriented. And so I was always trying to figure out how to bridge that gap into veterinary medicine. And so this is sort of where it led me into dealing with our canine officers. So specifically this talk, and I've also talked to Jessica. I probably need to, I don't think we're going to get through every single slide, but I'll pop through as much as I can. So we'll have some questions, but it was looking at my MPH research at the end was looking at pre-hospital care for our service dogs, or specifically our operational dogs. But we'll talk a little bit more about what service dogs are and how they are a component of One Health. And it's really, actually, the more you look at it, it gets cooler and cooler. So I'm gonna, if you guys have any questions, please feel free to pop in and ask if it's, you need me to clarify anything about where we're at. So we'll just kind of go from there. When we're talking about One Health and canines, it can cover a lot of different areas. Of course, veterinary care. I mean, our dogs of any sort are going to need, or any of our animals are going to need our veterinary care. Their canines are also involved in research. The human animal bond is huge. And actually, when you start looking at the work that I've done, it's a very, very large component of my training, because I train the handlers. So I do a lot of human training, not necessarily veterinary training. I do lecture some with veterinarians with how they would handle service dogs, but I do a lot more work with the handlers and or people that are around operational dogs. So that can also be looked at as any of your service dog owners and or handlers. So that the human animal bond is huge, because they work so closely together, or these animals are a huge component of this individual's life, if they're a disease detection dog or something like that. So of course there's public service. So that's kind of what you guys are used to seeing, is your police dogs, right? And dogs in general, since 9/11, have increased exponentially in the use of, in the public service, local law enforcement type areas. There was always a very large military working dog component that's been out there, and a lot of our literature and a lot of the stuff that we pull from that I use to train handlers comes from military working dogs. But it is when you start looking at the dynamic again with that human animal bond and what happens with those animals and their handlers, is a little bit different. So the public service component is huge. And then you have your service animals, which it can be delineated in a lot of different ways. I consider the service animals the animals that are ones that provide a service for a human being. So if you're seeing an eye dog, or if you have a animal that works with the individual that has PTSD, or if you have a diabetic alert dog, something like that. So those would be more of your service animals. I've learned and am interested in working with some more handlers with the environmental health component of these dogs, because they're now using dogs. We'll go into our next slide with that, to actually identify some very important um, environmental components in environmental health. So, and then occupational health. And when I talk about occupational health, I actually am considering the occupational health of the dog, not always the handler. There are two different things, but we need to, these animals are athletes, and they have to be treated as such. And so we have to actually consider how to keep them working for as long as possible. They're very highly trained, and they're expensive. So the longer they can work, the better. And so if we look at them in a component of not just veterinary care, but the actual occupation that they're doing and how we're going to keep them healthy within that occupation, that is something that I'm interested as well, and we talk about as well. So when you're talking about your canine public canines in public service, there's all kinds. This is just kind of a random a few that I picked that you're going to see. Of course, you're going to see search and rescue. They've been around forever. The St. Bernards that carry their little bourbon underneath their collar to deal with the folks that have been in avalanches. But the search and rescue is very highly used still in all aspects of disaster management, or finding individuals, if they're young individuals, older individuals that maybe have gotten out of the house and have dementia and don't know where they are. These animals are used to detect and find these individuals. Of course, our military use dogs, that's probably where you guys have seen them the most. They're used for all different types of stuff. Explosives, patrol, personal protection, and then of course finding things or people. The airport and transport security, these I think might be my favorite dogs to watch, because they're always the little dogs. These guys are like the beagles and the little terriers, because they actually have to go into the bowels of the airport and the bags and do the searches of the bags. You will see larger dogs there, but they will use a lot of times they'll have a lot of smaller dogs working in the airport security type stuff, at least with the baggage claim type searches. Border Patrol and Customs, you're going to see some of the larger dogs more. These are probably ones that you might feel like are a little more aggressive, that actually do patrol and apprehend individuals when they go through Border Patrol and Customs, or find drugs as they're going through that. And then your medical therapy and emotional support roles, that's what I was just talking about. There's all kinds of stuff, and it's growing. We've got all kinds of therapy dogs. We have a therapy dog here at the vet school. His name's Lane. He works with our therapists that work. We have a counselor for our students, and he is the counselor's dog, and he is a support dog for our vet students. So they're in nursing homes. Veterans have become, it's been very popular for veterans to have them. You can have seizure control dogs. These animals will actually detect seizure and hold the individual down so they don't hurt themselves while the seizure is actually happening, or while EMS or some help is trying to get there. Then you've got all types of disease detection dogs. Probably the biggest one that you guys have heard about will be the diabetic dogs. They're quite popular. You can have them for cancer detection. they're also using dogs in hospitals to find C. diff after they have cleaned everything. They've gone through with all the UVs, they've done everything. The dogs can still find C. diff, and so they know that they're um, controls that they're using or their protocols that they're using actually may not be working as well as they want. So they will have dogs run through and see if they can actually detect that. And then the environmental protection stuff, which is kind of crazy to me, they have dogs now that can actually detect invasive species and or endangered species. If they just can't find that, they know a species is in a certain area, these dogs can be trained to locate these specific animals and or plants to either eradicate or to help maintain in the environment. So dogs can pretty much find anything. They have the ability, their olfactory ability is about 1,000,000,000,000 times more than ours. And if they are trained correctly on a scent, they can pretty much find whatever what you need them to find. Um, some common breeds that you see is pretty much everything. Again, I took this from, I work mostly with operational canines. So you're going to see these larger breeds, the German Shepherd, Malinois, your Dutch Shepherds, and on down. But you also have your beagles, and I have pound puppy on here. Any dog can be a operational or search and rescue dog or disease detection dog. They have the ability to do it as long as they have the training to do it. So I often work with currently work with some of these larger breeds that are used in operational components, and we'll define that here in a minute. So those are, again, some of these larger breeds that you see in the slides. So operational canines, I have here a picture of a service dog. They are a service dog, but they're really specifically dogs that are trained to assist law enforcement specifically through protection, detection, or search and rescue. And they can be owned by a plethora of organizations or independent. And I think that's really important for people to understand that oftentimes, especially if it is a dog that works within the police force, the animal is not owned by the handler. It is owned by the municipality or the county or the state or the federal organization. So when they are having to have potentially some veterinary decisions made, it's not always the handler that can actually make those decisions at that point. And that's important for veterinarians to know, and it's important for individuals that work with these different organizations that you kind of need to front end some of those decision making, at least know what you're going to do for some of these decisions that may have to be made, so there's not a lot of back and forth. That's something that I've found people don't realize. Even in the veterinary field, they think that the handler owns them, and it may be that the handler does own them, especially search and rescue type stuff. A lot of times, the handler does own them, but many times, especially in the police force, they are owned by the state or the county or the federal government. So they will have to actually get permission from their organization to do treatment. Some jobs that you are going to see with operational canine, again, just like we talked about before, protection, apprehension, those are your bite dogs. Those are the dogs that you see that are coming at you with the arm, and I tell my son, don't run from the dog. If the police have the dog, don't run. So they are trained to apprehend anybody. I've heard some very interesting stories from police officers when they get in the way of the dog trying to apprehend a suspect, and they apprehend the police officer instead. So they're going to do their job. So there's also explosive detection, of course, drug detection. Jessica and I were just talking about the drug detection component. before this. So, that's what this picture of this chocolate lab here, they're actually looking for. They're detecting something. I don't know if what is on this one, but they are actually looking for a certain scent, and this is the training that they do. So they're looking for that particular scent, and the animal will alert in some way. It depends on how they're trained. They are either trained to sit, sometimes they're trained to bark, sometimes they're trained to lie down. It just depends on the actual dog and the handler themselves. Of course, search and rescue. There's also what's considered search and rescue and cadaver are actually different dogs, different trainings, because live versus a live individual versus a dead body does give a different scent, and those are different types of training. So your search and rescue may or may not, you may move to a cadaver dog if the search has gone to just a retrieval or finding component at that point. So just some things that you should be aware of. So when again, this is where I went into more of the vet stuff. So please let me know if you guys don't understand or want some more information, if this is not your area of expertise or you have questions about it. And when I work with different clinics or speak to veterinarians, this is the type of information that I give to them about how they need to educate their handlers. Because again, I said that the dog itself is an athlete. The dog is also an asset. That may be hard for some people to hear, but it is very, very true, especially when they are trying to make financial decisions on veterinary care, if it's quite expensive or anything, especially if you get down to an animal that has an extreme emergency, if they're going to spend the money on it. So I feel really strongly about this component of wellness, because we want to keep our animals healthy. And that is the veterinarian working interdisciplinary with the handler or the organization in a lot of different ways to ensure that these animals are maintained to the best of their ability so they can do their job to the best of their ability for the longest period of time. So that's sort of the goal with that. So we'll talk about safety here in a second, but in wellness, we have vaccines, parasite control, diet, housing. All of these things are something that your veterinarian is going to talk with your handler about. Spay neuter is another aspect that is a little different. Sorry, I just saw that there was something in the chat. I wanted to make sure I didn't miss anything. So it's a little bit different, and for our working dogs comparative to our companion animals, gastropexy, which is the tacking of the stomach to ensure that they don't have a life-threatening disease that can happen to them. But GDB, we'll talk about that very, very a little bit in just a few minutes. Dental work's also really important, especially for those apprehension dogs, because they actually can pull their teeth out, believe it or not. There's all kinds of emergencies that happen to everybody, but there are some common emergencies. And then, of course, I think canine or handler education is key in ensuring that we keep our animals safe. Okay. There we go. Okay. So safety is number one. So the reason, again, I told you that most of this particular lecture is talking about operational canines. Many of our operational canines are what's considered dual purpose or bite dogs, which means that dual purpose means they will apprehend or bite as well as do something else. So they may search as well as bite. So when I talk about safety, I mean that for everybody who is around the animal. it means the handler, it means the individuals that could be around the handler, the veterinary staff, any kennel workers, anybody that could be potentially around these animals, because they can be quite dangerous. Their bite force is like 800 psi. It can literally break your leg. So we don't want to ever put the dog or an individual into a situation where it's not safe for either of them. So it's important to know what type of work the dog does. So you can ask them, does the dog do bite work? Sometimes they're going to say no. Now, that doesn't mean the dog won't bite you, but there's a difference between the dog biting you and knowing how to do bite work. So that's something that's important to know if you're working with them, you know, what the actual animal does. You want to ask that handler what they do. If you have a operational dog canine in the hospital, I usually say the handler should be with them all the time. That's very different than our companion animals. We don't have our owners back with our companion animals a lot of times, but the handler should be with these animals if possible, especially if they are animals that do know how to apprehend and bite. It's just safer for everybody. Muzzle should always stay on if they're bite dogs. You do want to know, when I say you, I'm saying if you're not the handler and you're dealing with these dogs, you do want to know a few commands. I usually ask, a lot of times these dogs don't actually speak English, so at least in their command states, so that you want to know what their sit down and stay is. These commands, write them down. Don't let your people ask them what the bite command is. You don't want to know that. So, because someone is going to say something that they should not, and we just don't want that to happen. So sit down and stay is kind of my routine, you know. How do I talk to this guy? How do I make this guy? Sometimes heel is another one that is a good one to do. But having that conversation with the handler is so important, so you know how to keep yourself safe, how to keep everybody else safe. We talked about this a little bit. I'm going to kind of skim through just to make sure I get where I'm already getting close on time. So I want to skim through some of these things. Wellness, it's mostly like our normal person. We're going to talk about history, but work environment is going to be very different than our companion animals, and it can be changing all the time. They could work in 5 different states in one day, depending on the who they're working for. You know, your housing is going to be different. They can be in a vehicle all day, which can affect their joints, which can affect their attitude, actually. Usually I recommend a couple times a year they get good physical exams. They want to have good orthopedic exams, good routine blood work, all that type of stuff for wellness. Our vaccines are going to be our normal core vaccines. I won't go through all of those, but we do have some additional ones left. They do recommend, the AVMA does recommend that these dogs do have leptos vaccinations yearly, and then of course Bordetella. You do have to be careful about some of these things with if they are going to any of the vaccines, or some of the diseases can actually affect the olfactory. They can cause olfactory deficits, so you want to talk to the owners about that. And then also we have a lot of imported dogs that come into police work. That's just because there's all kinds of breeders all over, and a lot of dogs are imported. The recommendation for vaccines and any wellness is to treat all of your imported dogs as completely naive, and to start their vaccination protocols completely over, to ensure that they have gotten everything that you want to, everything that they should be vaccinated for. Our parasite protocol is going to be very, very similar. We're going to have internal, external parasite, but again, travel is a big deal, so you want to have that conversation with them. Our parasites are different in different parts of the country, so you want to know where these guys are, so they can be prescribed the correct medication to keep them healthy and keep their parasite burden under control. Spay neuter, this is one that is probably a little bit different than something you guys, or at least in veterinarian wise, would recommend to our companion animals. Oftentimes, we do spay neuter fairly quickly. If not, we can do pediatric spay neuter. They may do them, within the first few years of their life. Oftentimes, you will see the female spayed and the males not neutered. Um, there, there's trainers have different ideas. The females get spayed because they don't want to have an animal in heat with a bunch of other dogs. But they don't often neuter because they actually feel like it affects their drive. But the I always listen to the handlers. I am not a canine handler. If they feel like that's going to affect their drive, okay. But once the animal does retire, I recommend that they are castrated at that time. Just it reduces their chance of different types of cancer. I'm sure there's some other research out there that might say that it isn't the best thing. I think there is some where they've gone back to not spaying neutering, but currently this is sort of the recommendation from AVMA with their working dogs. So I've had a lot of folks talking about affecting the drive. I've had folks that have had their animals neutered because they were so aggressive or their drive was so high or for whatever reason, and they felt like it didn't do anything. So I'm like, spay and neuter your dog. But that's from 25 years of vet med. Dental work, again, very important to keep an eye on it. These are titanium teeth. You don't want to get bit by those. They will avulge, these canines, when they bite. So they will, they'll pull them and sometimes cap them. Some people have some pretty serious opinions about that. My opinion is if the dog needs to work, he needs to have good dental care. So that was between your dentistry, your veterinarian, and what they are going to recommend for dentistry. And then if the dog needs their teeth to work, they need their teeth to work. So you have to watch that because they also train biting. They will train to bite with their biting not utensils, but like biting equipment. So it does actually wear their teeth down. So you have to be careful about that. Nutrition is something that I feel like I need to do a better job in education. I feel like that's probably one of the biggest things that the handlers do not have a very good grasp on. I have this particular picture on here because you can see this dog is quite fit, but he's on borderline thin. You can see all of his ribs, and although he's very muscular back here in his haunches, he's pretty thin. So remember that these, again, are athletes. They can use up to 10 times the caloric need of a normal pet. So they need to be on a correct diet. I, again, am not a veterinary nutritionist, so I often recommend that they do consult with the veterinary nutritionist. The University of Georgia has more than, I think they have 2 on staff, maybe 3 at this point, and they will do a consultation with whomever to ensure that the dogs are getting appropriate nutrition, which is really important to keep them healthy and working. Identification, a lot of these dogs will work without collars at some points because, especially if they're in search and rescue, they may have a vest on, but they'll get caught. So you want to ensure that these animals are tattooed, chipped, something, so you can identify them. It's a couple examples here. This little shepherd has a tattoo on his ear. He got that as a breeder. And then I'm not sure what kind of dog this is, but there's another tattoo that you have there. So this goes back again to my veterinary friends. If you have in-house patients, number one question is, does that patient need to actually stay? Can they go home? Now, this particular patient that I have a picture of looks like he needs to stay. He's on IVs and has some pretty significant trauma going on to him. But you'll also notice that the muzzle is on while they are in-house. I do recommend, if the handler can stay with them, to have them stay. Again, educate your staff. I kind of am hardcore about the muzzles with this particular dog, but realize that not all working dogs need to be muzzled. There are some drugs that need to be avoided. There's a few here that actually will affect their olfactory abilities. Usually they're transient, but if you are a veterinarian, you may want to consider that as you're working with your handler and what you want to recommend to do that, or if they just don't go back to work while they're on their drugs. Canine distemper can have a significant effect on their olfactory um, ability. It may not be transient, so especially the dogs that are imported and we don't know their full medical history, that's something you want to talk about. Parainfluenza can affect it. That's more of a transient thing. And then there's a few other issues, of course, nasal tumors, obviously. Some inflammation. GME is an inflammatory component of their brain, and then we have some endocrine issues that can also affect those things. And this is when you're going to start trying to decide if these things are affecting the animal, can the animal work? Because that's going to be what the folks want to know. Jessica, it's 15 till. Should I run through emergencies or should I ask for questions?
Yeah, run through emergencies. Let's hear a little bit more. It's really
Okay.
fascinating.
Okay, this is by no means, as we know, there's all kinds of emergencies in the world, right? So this is by no means a comprehensive uh, emergency list. This is just some of the stuff that we talk about. So GDV is volvulus of their actually GI system. It is a deadly disease. It is pretty much curable if they get I don't know if curable is the correct answer. Curable. I saw that Dr. Grimes is on here, so if she wants to pop in and tell me what the right answer is, it decreases their uh, ability to actually twist their stomach because their stomach is actually tacked to the side of wall of their abdomen. So it is a very good procedure for working dogs to have, especially the large breeds. So they can do that via scope. I do recommend that for all of our large breeds dogs. They do often, it is expensive to do a gastropexy. It is also extremely expensive to treat a GDV. So you kind of need to do the math with what that. My recommendation is to gastropexy. I think we've gotten most of our state patrol dogs pexied over at Georgia. So all of the military dogs, just FYI, everybody gets pexied. So if we're using them as a good example or best practices, that's what they do. We need to make sure that we educate our handlers on what we're going to see with GDV. And again, that's through with our vet partners, and how to educate them, what they need to recommend. And then we're talking about pain management. We're going to move on from there. Heat stress is another huge issue here in Georgia. It's really a huge issue for any of our working dogs, but I often, I'm like, we live in Georgia. And dogs will work themselves to death. So it is very important that the handlers know how to treat it and how to recognize it. Probably the biggest thing to do is they need to learn to work their dog appropriately, which means they'll need to learn how to stop the dog. The dog will continue to work. So I talk with the handlers about when they need to stop their dog and make them sit and rest and cool off. There are some techniques that are very specific for reducing heat stress. There's some new stuff that has come out of the Penn Vet Canine Institute about how to cool your dog off very quickly. It's very interesting. They're actually submerging their head and getting them to blow it through all of their turbinates. And so that's been the fastest way to cool it off. So they are in vehicles, so you want to ensure that your police officers or your handlers have the ability to have quick release capabilities in their vehicle. If most of the time they leave their vehicles running to keep the AC on, but sometimes they stop. That's probably, you probably have seen some literature on some animals that have passed because of that. And the handler didn't realize that the vehicle had gone off and the animal had a heat stroke in the car and passed away. So you want to ensure that they know what's happening. So timed work, again, we live in Georgia, timed work, education of your handler. Some dogs depends, they can work for 5 minutes, literally, if they're doing a search, and they have to sit for 10. So it is, and it's not something that they want to do. So you have to tell them why it's important. So, and then supportive care while you're in the field. If your animal does have heat stroke, you do need to go to the vet, but there are some things that they can do prior to going to the vet. Gunshot wounds are another big issue with our operational dogs. You know, bleeding is bleeding on any living thing. So we're going to learn how to stop the bleed. We're going to learn some junctional tourniquets, where you can put a tourniquet on for the dog, where you can use hemostatic gauze, where you can use your clotting spray, or if you need a wound pack. So we go through that. Very important for them. Also puncture wounds. Lacerations and puncture wounds, again, very common in all dogs. This is something that I train a lot of them, because this is something where they don't even know they've been punctured, and then all of a sudden they have this terrible smell, and then they find a random puncture wound that they had gotten from a search, 5 days ago. So raking the animal basically means rubbing the animal down, making sure there's no holes. So palpate your animal. And then if you're out in the field, you're going to want to cover, compress, and then transport to your vet. The goal to my handlers, the end of the sentence for everything is go to the vet. If you're questioning anything, go to the vet. And that will subside all of that stuff. Burns also are an issue. I have I have foot pads and then explosive work here. So it's a pretty wide variety, but we do see a lot of burns in our foot pads. It can be seasonal or situational. So what I mean by that is, again, we live in Georgia. The concrete and the asphalt are 150 degrees, literally. If the pads are not conditioned, they will burn their pads off. So you have to be very careful about that. There's a couple of different things. There's this pad toughener. I, again, listen to my handlers. I have learned that the foot wax is not the best to use, because it actually holds material in it, especially if you're working in a disaster area or something like that. You might actually hold material in the foot wax or get rock or anything in there. So that is not necessarily recommended. They have all types of ways to toughen pads, which some are good and some are bad. This is just an actual spray that you can use. Handlers do not like to use booties. Feel like this is something that we could develop a better one. Because it sure would be great, because what ends up is they all end up with vet wrap on their feet, especially in disaster environments, because they will cut and lacerate their pads, but they'll still want to work. And then burns literally are explosive work. This is a whole nother topic. If they get any type of this type of stuff on their fur or their skin, they do need to go through some decontamination, and there's a couple different ways depending on the type. If it's wet or dry, decontamination, that's the important component. And so it sort of has to do with what your handler's doing, or what kind of work your animal's doing. So handler education, huge. They are, my research with my MPH is pre-hospital care, and there's not a vet there, and there's probably not a veterinary nurse there. So the handler is what you got. So you need to educate them on how to do what they need to do to get their animal as stable as possible, and then send them to the vet. So again, wellness, vaccines, prevention, nutrition, and then resources. That's what our veterinary community is going to provide for for our handlers, or even anybody who's interested in learning about these guys. Always have, your first aid kit. I have a little kit for them to, go through. I teach them how to do all kinds of different stuff, and palpating, and how to assess their dog, know your vitals, know how to stop the bleed, know how to bandage a few things, know your common emergencies, know CPR. We unfortunately have we don't have a very good rate of recovery from CPR, but it does make the handler feel like they have some control of being able to do something if their animal is in cardiac arrest. Again, it goes back to that human animal bond, giving them some sort of option to do something and then go to the vet. Hopefully they'll be successful in that. And then here's just a little example of some first aid kits. This paw print oxygen I love. It is literally, it costs like $250 a case, and it's portable oxygen. I tell my handlers to just get one for your whole unit. Oxygen never hurts anybody. And it comes with a mask, and you put it in a little compressor or a little valve, and you put it on there. If your animal's in distress, you give them some oxygen and you go to the vet, and hopefully they can assess the issue and figure out what's happening. So I know that was really fast, but I have 5 whole minutes. Hold on, I have to figure out how to unshare. How do I do this?
There should be a stop share at the top of the Zoom screen, if that helps any. Sometimes it's hard to find when you're
Oh, here it
using
is. Here
multiple
it is.
monitors.
You're
Yeah.
sharing. Stop share. There we go. I did it.
I tell you,
Okay.
that was like a really fascinating presentation, and learning about all of the intricacies that go into the, operational animals like that. I mean, things I didn't even think about you brought up. So that's really fascinating. Thank you. I'll just, while people are thinking about their questions, I have a quick one. One Health is all about optimizing health and well-being for
Mm-hmm.
humans, animals, the planet, and you talked a lot about how to keep particularly like the canines like in optimal state of health. What kind of research or programs, successful programs have you seen that really optimize the like well-being of the animals? Because I will tell you, as you said, like they want to go and they want to do, and they
Uh-huh.
have that innate instinct to that's their source of fun in many ways. But
Yeah.
what are some of the research you've seen about well-being?
So I think, again, the military has the best information. They do the best job because they have the resources. Um, I think that there are several different companies out there that will come out and train. I think the biggest thing is literally teaching your handlers. Handlers do not get this education in handler school. There is canine handler school. I should have said that. It's 6 weeks. They learn how to scent. They learn how to bite. Or the handler does. They have zero wellness education. So I think it needs to be intercollaborative or interdisciplinary collaboration with, law enforcement and or whatever. I'm saying law enforcement because that's what I work with, and the veterinary community, to ensure that they have the right information, because everybody, they're going to look at Dr. Google. They're going to use what the handler next door is using, and they aren't, veterinarians are experts. The veterinary nurses are the experts in this field. So I think ensuring that we have that relationship with your vet, like that's the biggest thing. I like, know where your vet is, call them, ask them questions. I mean, my handlers call me all the time. I talked to them this morning for here at Georgia, just ask me random questions. So having that in place, and the handler has to learn their dog too. So once they learn their dog, then they'll know what the right thing to do to do is. And they want to do the right thing. Like they want to overly do the right thing sometimes. I'm like, it's going to be okay. So it's, I don't know if that answers your question, but having that
Yeah,
good relationship with your vet
yeah,
is
and it sounds like there's opportunities to kind of beef that up as well, which is really cool. Janet, I see your hands raised.
Yeah. When you say handler, I just assumed, and that's always wrong to do, right? That the handlers were like in a structured environment. So if they were search and rescue or law enforcement, that would be a part of their training, but it sounds like it's not. Is that like anybody can be a handler and then do they contract for things or do they just volunteer for search and rescue?
So that's a
How
good
does that work?
question. Yeah, so it's a good question. So a lot of your search and rescue disaster management is going to be volunteer and or state services, or people will come in. When you have law enforcement, those are owned and then go to work for the county and or whichever county that like there'll be relationships with if they have relationships with their counties around them. So no, in the especially in the law enforcement component, the dog is a commodity. It's a component. It's like a
Mhm.
gun. It is so having to learn a wellness component is not something that is built into that training yet. It's getting there. They're learning to do that. I think it's a little bit better in search and rescue because they are more often independently owned. And so those owners will
Right.
try to do stuff, but no, they're not required to have any of that training to
So
provide that service.
one more question. I mean, would that require like going to county commissions or maybe at the state level to
Sure.
create a mandate that they
Great question.
have to be
So
part of the program?
yeah, the work that I did with my master's program was actually looking at some of the legal components of it because, again, I said if you're in an environment like this, there's not a vet there, there's not a nurse there, a veterinary nurse there. Who's there? The handler or EMS? EMS is not legally able to touch that dog or give them any sort of medication or oxygen or anything like that. There are, I think, 20, I should know this because I actually wrote a paper on it and I can't remember now. I think there's 24 states that have some legal component in there of what they can and cannot do. But only one or two of those actually have training. So to answer your question, it needs to be at a state level. There needs to be legislation that is required for these individuals to have that training, and the training needs to be accredited by somebody. That's the other stuff. We've got people that are training, and it's
Yeah.
not the right stuff.
So it almost sounds similar to the FAA, where you would have trained, like the FAA has trained physicians for pilots, like you'd have the trained, and then the people have to go for the certification.
Yeah,
That's where you
yeah,
guys need to elevate, is what it sounds like,
yeah,
too.
yeah. So
We'll get
I
there
actually,
someday, right?
well, I actually applied for a PhD last week to do this research. So we'll see if that actually happens. And so I don't know. I
I
think Ashton was next.
Thank you,
yeah,
by
I
the way.
think
Yes.
Ashton has a question. And then
Yes.
yeah.
Anna, I just wanted to say thank you so much for the presentation. So I'm the EMS epidemiologist for the state of Georgia with public health.
Oh,
But
awesome.
so I'm type 1 diabetic. So I personally have a diabetic alert dog and he's amazing and he has made such a difference in my life. But I'm actually working on I need to connect with you because I'm working on a training for our EMS personnel in Georgia about service dogs and what to do, if they come across an individual that is accompanied with a service dog and needs
Yeah.
transportation.
Accessibility, that's a whole nother area that I'd be interested in looking at with service dogs, and veterinary care too. It's like we teach that to some of our vet students. Actually, we teach that to
Mhm.
our vet students. Just about, how if you have an individual that comes in with a seeing eye dog, how do you remove that dog? What
Right.
do you do with there's two things here. It's not just the dog, it's the individual too.
Mm-hmm.
So, or if you have a deaf person that has a dog who is a companion animal, how do you communicate with that individual to understand what they need. So I think that's a huge area of research that could happen of just about accessibility, veterinary care, and service animals, however that looks. So yeah, I think Arita put my email on there. Shoot me
Yeah,
an email.
I notated it, and then I also personally I kind of want to get with you because so I volunteer and teach at the organization that I got Finn through, and I would love to get with you about talking about kind of like a first aid type situation because so our organization we do provide dogs for local like law enforcement everything, of course for individuals with disabilities, but also we've got, I can't remember, is like two dogs up in Cherokee County that are working with the court system for kind of support for like individuals who have to testify. They're doing a lot of stuff with children and everything. But
Yeah.
yeah, I'd love to get with you offline. And
Okay. Yeah.
I'm gonna stop talking so other people have an opportunity because I could talk about service dogs all day.
That's great. Thanks, Ashley.
Yeah,
Arita.
Dr. Samples.
Yes. So first off, again, Anna, thank you so much for the presentation. It was very interesting. But a couple of points. Many years ago, Fort Valley State was we worked with the dogs in Peach County and Fort Valley as far as doing care and all, and when with Dr. McCommon. And I have to share just a really quick, funny story that when the guys would come in, they would all come in at one time with their dogs. Like we would take a Friday and just block off 2 or 3 hours, so they could come through. And so we're back in the lab. We pulled blood on everybody. We're running heartworm tests, and all the guys are standing around. And it was when cell phones were first becoming a big deal, and everybody had a cell phone that had the cameras on them.
Mm-hmm.
So somebody pulls out their camera and says, they were talking about, oh, the love of my life. And he said, well, let me show you. And he pulls out his camera and his phone, the screenshot is his working dog. And then the next guy says, oh, that ain't nothing. Let me show you mine. And now we got 5 or 6 guys out there that, honest to goodness, probably the best looking cops in Peach County could have any woman in the world. And their screensavers are of their dogs. And I was like, that would make me fall in love with you faster than anything else.
They love their dogs. Absolutely. All of them.
And so that leads me to my question of when these dogs, when they retire, and I'm thinking more police, sheriff, etc. But when these dogs retire, are the handlers giving first option if they want to take them home with them?
Most of the time, yes. If it is, especially the people that I work with, the state and county, yes. And here, federally, I'm not sure. It may depend, but most of the time, the handlers get first dibs, and really, it's the best place for them, especially if they're any sort of apprehension dog, because they don't need to go to someone who doesn't know how to handle them. But yeah, the handlers usually adopt them. All of our police dogs here at the University of Georgia, the ones that are adopted out, do go to handlers first.
I was just wondering I know with now I don't know how it is now, but back in the day, the Peach County dogs, they went home with their handlers. They were with them 24/7.
They do.
Okay.
And that is going to be dependent on your ordinance in your county. Some won't allow it. Some have to be on, like here, our dogs have to be on campus at certain times. It's going to depend. Some, they have a kennel master. Everybody goes to the kennel at night. Some go home. And that's going to be county-wide, like whatever their county decides.
So with the dogs that don't end up, that they're going to retire and they don't end up going home with their handler for whatever reason, how's the status on their mental health? Because that's kind of like taking an animal away, it's kind of like taking a child away from a parent. I mean,
there's I don't know the right answer for that, but I know there's a few organizations out there that do adopt out. That's their mission, is to adopt out police dogs or working dogs after they retire if the handlers can't keep them. But no, you're absolutely right. And even, they will change handlers sometime, and that's another issue, like just getting to know your new partner, right? So
Hmm.
it's not 100%. Most of the time the handlers will take them, but there are some associations that do adopt them out if they can't.
One last
Otherwise,
question. Yeah,
yes,
one
ma'am.
last question. Can a police dog or a service dog of that type, can they be cross-trained, say, maybe in their retirement to go work with a deaf or a blind person?
Oh yeah, I'm sure they get, it becomes liability and physicality, especially, with what they're doing. If most like our dogs here, and I think State Patrol will work them till they're 7 or 8, but they'll start breaking down, hips start hurting, cruciates start going.
Yeah.
So yeah, they can absolutely be trained to do something else that may not be if behaviorally they're able to do it.
Hmm.
um but it's just, it's getting old. It's hard for everybody, even
Yeah.
dogs.
Amen to that. Well, that's all I have. Thank you.
One more quick question because we're a little bit over.
All
Oriana?
right.
Yes. As someone who used to work in a clinical setting, there's a reason why we don't bring owners in the back. It brings up a lot of high emotion, and it's kind of hard for them to see their animal in that type of position. And I know that you mentioned bringing or asking the handlers to come back. So, in that
Yeah,
type of situation, how do you recommend a technician or a veterinarian to navigate those feelings for those handlers that are now being put in that situation?
that's a great question. um uh I am 100% honest. I am saying this is what we're going to do, and you're going to be part of the healthcare team now, because you may have to handle the dog for me because no one else can. And this is not a normal situation. I would not say that to an owner that had a dog that I couldn't handle. I would probably sedate that dog. But the handler will come back and restrain potentially for me. I've seen handlers standing outside of surgery and watching the entire thing. I just tell them what's happening. And they become part of that team because they need to be. And you're absolutely right. That's not something that we normally do. There's a few organizations or a few types of corporate organizations that's their model, where they do have owners a little more involved, but not necessarily in veterinary medicine as much. But handler wise, it's just better for them to be involved, especially if they are any that the animal shows any type of aggression. It's just better treatment for the dog. And then I asked people to be respectful of the handler and the dog. And I also asked one person, like, we're not having 15 people work with this handler and dog. It's one nurse, one dog, one vet, and you guys are going to be your team. You're going to work together. You're going to get this dog going through here and be done with it. People are really, everybody loves dogs. They want to touch the dog. They want to do stuff. So you kind of have to rein that in a little bit. And then I just tell my handlers that this is what's going on. And I will, especially if you're going back into an ICU or whatever, it's like, you're going to see some other dogs that aren't so great. So be prepared.
Thank you
Okay.
for that.
Yeah.
Well, Anna, I told you there would be a lot of great questions at the end, and the consortium did not disappoint. So, thank you so much, Anna. I really appreciate it.
Yeah.
And Dr. Samples, thank you so much for putting her contact information in the chat and inviting her as a speaker. Guys, I will keep it short. Thank you for being a part of the consortium, and we look forward to seeing you next month. Take care.